Good morning. My name is Vish Viswanath. I am the Lee Kum-Kee Professor of Health Communications at the Harvard T.H. Chan School of Public Health and the Dana-Farber Cancer Institute in the United States. What is relevant for today's discussion is my background work on vaccine hesitancy. As a part of my research, I have chaired the Vaccine Confidence Working Group for the National Vaccine Advisory Committee for the Department of Health and Human Services for the United States government. And we have generated a report that has paid close attention to how to promote confidence in vaccines and reduce hesitancy. In that context, today's talk will become extremely relevant for what the globe is facing with the COVID-19 pandemic. And to start the interview off, we have Mr. Mukesh Kejriwal from Rajasthan Patrika. Over to you.
थैंक यू डॉक्टर विश्वनाथ। आज की हमारी चर्चा कोविड-19 वैक्सीनेशन को लेकर सही जानकारी और सूचना लोगों तक पहुंचाने की कोशिश है। डॉक्टर विश्वनाथ, इन दिनों खास तौर पे कोविड-19 वैक्सीनेशन को लेकर सोशल मीडिया और जो मैसेजिंग प्लेटफॉर्म्स हैं तरह तरह के, उन पर कई तरह की डिसइंफॉर्मेशन और मिसइंफॉर्मेशन खूब चल रही हैं। साथ ही लोगों के मन में बड़ी फार्मा कंपनियों को लेकर कुछ अविश्वास भी है। तो कोरोना काल में इस समस्या से हम कैसे निपटे?
The spread of the information is much faster and much broader than has been the case in the past. So the question is, what can one do about it? I think there are two broad groups of solutions. I think one of them starts with the social media platforms themselves. I do think the social media platforms have an obligation and a duty to actually monitor, track, and actively intervene of the information that is being spread around, or the false information that is being spread around on their platforms. Because individuals do not have the capability or the computational power to do this. The social media platforms themselves have been reluctant to do it, and they have been late to the party, so to speak. But it is very critical that they take a more aggressive stance and position and action against misinformation. And they have begun to do that. They have begun to actively intervene. When necessary, they actually identify information that is misleading on vaccines and say so on their posts. They also are preventing the forwarding of these tweets or messages or postings. So that is also a very good step. And third, they are directing people to more reliable sources of information, which again is an important step. Now, at the individual level, I think we have to encourage people to become much more vaccine literate, so to speak, and that means really educating people through public communications on the advantages or benefits of vaccination and immunization. Now, when we do that, there is a fundamental misunderstanding about how to do this education. People often think that if we can just provide the facts and the science, that will suffice and preclude people from being influenced or being susceptible to misinformation. That is necessary, but not sufficient. If you really want to combat it, I think, in addition to social media platforms preventing the spread of misinformation, we have to help people understand and process this information. That means providing them with facts and science, but also through understanding their fears and doubts and communicating information that addresses those doubts, that addresses those fears. And we have good evidence on how to do that. How do we promote information that is emotionally appealing, how to promote information that can reduce counter arguments through stories, such as success stories of people who have undergone vaccination. So it's really, maybe a third point I should also say is that people who are communicating about the value of immunization should be on the same page. That means pharmaceutical companies, the government, and the non-governmental organizations should all get on the same page. If they are not on the same page, if they are not communicating in a very coherent fashion and contradicting each other, then it will only create confusion in the minds of the public, and that will be a great disservice.
डॉक्टर विश्वनाथ, यूएस एफडीए ने भी कोविड-19 वैक्सीनेशन की परमिशन दी है। वहां भी लोगों में इसको लेकर हेजिटेंसी है, आशंकाएं हैं और इससे निपटने की कोशिश भी हो रही है। इस पूरी प्रक्रिया से आप भी जुड़े हुए हैं, तो वहां का जो अनुभव है उससे भारत कैसे सीख सकता है?
Have been very successful in the United States on vaccine hesitancy. Our success is somewhat mixed. On the positive side, a number of us have been drawing attention to the necessity of planning public communication campaigns to reduce vaccine hesitancy and promote reliable vaccination information. So we have, and a number of groups have been extremely active on this, particularly on the non-governmental side. Groups have been tracking and monitoring anti-vaccine forces and the kind of misinformation that they have been spreading. So that gave us an advantage in terms of what these anti-vaccine forces are doing. That has allowed us to make the public alert about anti-vaccine forces and how they are misleading and how they will likely mislead and what kind of themes and strategies they will use to mislead the public. That is, we have brought greater sensitization to misinformation and disinformation among the public. Also, we have put anti-vaccine forces and certain institutions, religious institutions or political institutions that are promoting doubts about vaccination on notice. Some of them are deliberately misleading. Some of them are raising concerns based on their ideology or religion. And we have put them on notice saying that we are watching this, we are watching you, and we will continue to counter your information. It is sort of an inoculation effect, if you think. And so public is somewhat better served when they know that anytime there is a vaccine-related misinformation, it is being actively countered. Plus, we are working with healthcare providers who have tremendous credibility in addressing vaccine hesitancy. Because at the end of the day, people will go to their doctors or nurses who are on the front lines and ask them to clarify their doubts. So we have to prepare our frontline health workers, and there have been efforts to do that. Last, in the United States, journalists have been playing a very important role in this process. Unlike 10 years ago, when journalists, in the interest of or in the name of objectivity, allowed anti-vaccine forces to be quoted, and interviewed them. These days, journalists are much more informed, and whenever there is an anti-vaccine misinformation or disinformation, immediately draw attention to the fact that whatever that is being said by anti-vaccine forces is misleading. So journalists have become very sophisticated in the way they cover misinformation about vaccines, And that has also helped a lot in at least reducing hesitancy in the US.
बिल्कुल। और इससे जुड़ा हुआ एक मसला है कि कोविड 19 को लेकर लोगों में जो भय है उसे भुनाने की भी कॉर्पोरेट्स की ओर से कोशिश हो रही है। हाल ही में भारत में सेंट्रल कंज्यूमर प्रोटेक्शन अथॉरिटी ने पेंट बनाने वाली एक कंपनी को नोटिस जारी किया है। हाल यह है कि फ्लोर क्लीनर से लेकर सिल्क की साड़ियां बनाने वाली कंपनियां तक कोविड से रिलेटेड तरह तरह के दावे कर रही हैं। आप क्या कहेंगे?
Yeah, so I mean, this is not unusual. This is not new. We have always had what we called as in the US snake oil salesmen. Historically, advertising started off when people palmed off all kinds of products as a panacea to cure illnesses, and that has not changed over time. It is not at all unusual for organizations to take advantage of people's fears, and make a quick buck out of it. For example, you see advertising on hair loss, as one example, right? Whether these products really work to address these underlying problems or not is always questionable, but they have always been there. I think COVID-19, so it's not unusual in that situation. A lot of companies are trying to cash in on these fears, and they will continue to do that. The only way to really deter it, you cannot eliminate it, but you can minimize it, is by aggressive enforcement by the legal authorities. Whether it is the FDA, Food and Drug Administration in the United States, or the Federal Trade Commission in the US, or the India's Central Consumer Protection Agency authorities. These are the groups that should be very aggressive and active in pursuing these people, and make it very expensive for these companies which are marketing this. Plus, I think you should, journalists have a very critical role. You should continue to draw attention to this fact that these companies are trying to cash in, and that authorities do not approve of it. This has not been regulated, signed off by the regulatory authorities. I think, if you do those two things, you should be, between journalists covering these stories, as well as authorities aggressively pursuing these people, I think that can minimize this kind of a commercial marketing.
हम सब देख रहे हैं कि अमेरिका से लेकर भारत तक कोविड 19 वैक्सीनेशन का मसला राजनीतिक दांवपेच में फंस गया है। ऐसे में लोगों का विश्वास डॉक्टर्स, नर्स और जो हेल्थ सेक्टर के जो प्रोफेशनल्स हैं उन पे बहुत ज्यादा है। आप जो हेल्थ प्रोफेशनल्स हैं इनसे क्या उम्मीद रखेंगे, क्या सलाह देंगे कि वो किस तरह से कोविड 19 वैक्सीनेशन को लेकर सही सूचना लोगों तक पहुंचाएं?
While immunization and vaccination has always been politically influenced by some groups or others, the COVID-19 situation has actually accentuated that problem. Unlike in the past, this has been, in my mind, the most political or the greatest politicization in the history, I think, in many ways. Whether it is a particular political party in the United States or right-wing forces in many parts of the world, they have been very active in spreading misinformation and disinformation around COVID-19. So it is not at all unusual for people to become very confused and being influenced by it. All public health measures, mitigation measures we have taken have been subjected to this kind of politicization, and vaccines are no exception. But what we need to do, in the US, our experience is that at the end of the day, doctors, nurses, and other frontline workers are the people that who are on the are the patients turn to these medical providers, or what we call as healthcare providers, for assurance that the vaccines are safe and effective. And so a lot of these people, have questions, and that's reasonable to have questions. But they go and at the end of the day make a decision based on what their doctors or nurses say, or pharmacists. So what we do is are trying to equip the frontline health workers and healthcare providers to get the information they need and have the necessary toolkits they need to talk to the patients and have a conversation with them in order to provide that assurance. And that the same thing could be done in India. We have to, in India, of course, the scale of the problem or the magnitude of the problem is much higher. You have frontline workers in the villages who are going to be vaccinating.
ये तो बात हुई हेल्थ प्रोफेशनल्स किस तरह से लोगों का विश्वास कायम करें। अब बात आती है साइंटिफिक कम्युनिटी की। एक साइंटिस्ट जब कोई बात कहता है तो उसका अलग ही असर होता है, लेकिन बेहद जरूरी है कि वो बात इस तरह से कहे कि लोगों को सीधी समझ आए। तो क्या आपको लगता है कि साइंटिस्ट को भी इस बात की ट्रेनिंग देने की जरूरत है कि वो जार्गन फ्री तरीके से अपनी बात रख सके?
Right. So our data clearly show the research we have done. In addition to doctors and frontline health workers, scientists and researchers have tremendous credibility. In fact, globally, the survey data show that scientists are one of the most credible people, researchers and scientists. So in fact, in a recent study, we looked at if the public has a high level of trust among scientists, they are much more likely to take COVID-19 vaccine. So the question is, how do we prepare the scientists to communicate in a very clear way? No, not all scientists are ready for this kind of communications. But those scientists who are willing to communicate information to the public should be trained on how to really construct messages, how to talk about science and vaccines, how to use examples from their own work to ensure that whatever they try to do is in the best interest of the public. This is what we call as media training. It is routinely given to scientists who are interested in public communications. So that's one way to do that, to provide those scientists who are willing to do it, that kind of a training. The second part is science communication. We have to train people, media professionals, as communicators in science communication. And that again, these are what we call as knowledge brokers, between scientists and the public. People who understand how science works and who can take the scientific information and put it in a language that people can understand. We also, we leave too much burden on scientists and science communicators, which is important, but we also have to work with non-governmental organizations who are actually closer to the people, and people trust them too. So we should work with NGOs to see if we can train them in science communication and how to communicate evidence.
बिल्कुल, आपसे बहुत सारे सवाल हैं, लेकिन अंत में ये बताइए कि जर्नलिस्ट इस संबंध में जब रिपोर्टिंग करें तो वो कैसे अपने फैक्ट चेक करें? कौन से रिसोर्सेज हैं जिनको देखने की आप सलाह देंगे?
Journalists play an extremely important role for the credibility they have. And there are ways you can do that. I think in Project SANCHAR are providing a number of resources on our dashboard for journalists, including what are the frequently asked questions and answers to those frequently asked questions. What are the myths that are pervasive out there, and how to address those myths about vaccine hesitancy. So our tools that we have developed on the dashboard, I think will be particularly helpful, number one. Number two, I always feel that that regulatory authorities um, uh, generally make good decisions. Now, sometimes these decisions are questionable and they're not very clear, but generally they make good decisions, at least from a public point of view. And again, paying very close attention to global regulatory authorities and how they are making those decisions is very critical. The fundamental issue here is, what is the evidence? What are the data that are informing your decision, right? These are the two questions that journalists should be asking. What are the data out there that are making you decide in one way or other? What is the evidence you're bringing to the fore to make this decision? It doesn't have to be very aggressive, or you don't have to have any suspicion. You just ask for the evidence and then reach out to the public on the basis of which this decision has been made. The other thing is to interview scientists who can communicate very clearly on these data, the extent to which the data that have been collected and used to make this decision, how reliably have they been collected, how representative they are of the people, and what are the limitations of the data. And last, I think the journalists should be very frank with the public too, in saying what the scientists know, what the regulatory authorities know at this point, and what they don't know. So I think in many ways, more than at any other time in the history, journalists have a lot of resources and in their hands. Scientists, regulatory authorities in the world, World Health Organization, ICMR, CDC, they don't always have to agree on a common decision, but you can continue to raise questions about and ask for the data, ask for the evidence base. Plus, you have articles, scientific articles that are at least the abstracts that are available to you through PubMed and other resources, and you should be able to at least read them, at least read the abstracts to prepare yourself to ask these questions. I think there is no, my feeling is that there is a great need for skepticism, but no need for cynicism.
बिल्कुल सही कहा आपने। सवाल खड़े कीजिए, लेकिन पहले से यह तय मत मान लीजिए कि जो हो रहा है वो गलत ही हो रहा है। साथ ही आपने बताया कि कोविड-19 वैक्सीनेशन को लेकर सही सूचना किस तरह लोगों तक पहुंचे, डिसइंफॉर्मेशन और मिस इंफॉर्मेशन कैसे रुके। अलग अलग वर्गों के लिए, चाहे वो जर्नलिस्ट हों या हेल्थ केयर प्रोवाइडर्स हों या फिर बड़ी कॉर्पोरेट कंपनियां हों, इनके लिए क्या जरूरी चीजें हैं वो भी आपने बताई। बहुत बहुत धन्यवाद डॉक्टर विश्वनाथ आपका। नमस्कार।
Thank you, Mr. Kejriwal.